Now people talk about prehab, which is a word that I don't really like much, but the idea of some conditioning prior to surgery and greatly improving the outcome and the speed of recovery is absolutely recognised and strongly encouraged. So I think to say, oh, you'll have physio or surgery is ridiculous. You might just have physio, but you will not have surgery without physio. It's a really important part of it.
Do you see that as a general issue within people that you treat, with the expectations of what the outcomes are post-surgery and the timeline for recovery?
I know that Jack sent this through this question, but it's something that we asked Pam, who is just finished her orthopaedic training, but this expectation that the surgeon, the buck stops with them and they're going to solve the problem for that individual. How do you, you're obviously a very experienced surgeon, how do you deal with that, and how do you manage those expectations of that individual so that they're not expecting some sort of magical outcome when you're looking at their presentation saying, okay, this is what I think will be a likely ballpark for you?
It's a hard one, isn't it? Because I think you want to give people realistic expectations.
Yes.
I think that's really important. But you don't want to hold them back too far, because then you'll put a lid on what they think they can achieve, and that will become self-fulfilling.
Yes.
So you want to be able to give them optimistic projections, but not stupid, unrealistic ones. So I try really hard to do that. And I had a lady who said to me, who arrived, first time I met her, she said, "Thank God I'm here. You're my last hope." And
no
I said,
pressure.
No pressure. I said to her, "That's a very heavy load on my shoulders." I said, "Can you tell me who you've seen already?" She said, "I can." I said, "I've been to the chiropractor, I've been to the naturopath, I've had orthotics." She listed a whole lot of people who then got progressively slightly more off-centre as she went. And I said to her, "Well, for the problem you've got, have you ever thought of seeing someone who might be able to help you?" Because I felt the people she'd seen, she picked poorly. So
how did she take that?
She probably thought I was some arrogant idiot. I don't know what she thought, but but I think expectations are critical.
Absolutely.
But I won't accept anyone saying to me, you're my last hope. I just say that's not realistic, and you don't look at it that way at all. And I try really hard to map out what I feel is possible to achieve, and that understanding you may not get to that, but there's a high probability you will. But it's not just a matter of me doing an operation and suddenly all these things are going to happen. There's way more to it than that, and that a large part of it is them, not me, and help from various other people. And so it's a real team effort, and what I do is very much a team effort. I work really closely with a physiotherapist, Amir Takla, who actually works in the room next to me.
I know him. Yeah, he actually taught. Jack and I both at Melbourne Uni, and he was one of our teachers there.
I operated on him here. That's how I met him.
Oh, really?
Yeah. So he came to me a lot of years ago now, and I operated on his hip because he'd hurt it, I think, in about 2000. He was at the Sydney Olympics. He saw a whole lot of the sports guys up there, so the cream of sports medicine people in the country. I think he got 6 different diagnoses, none of which were his hip. And so he did all his treatment, things that they told him, and ended up I operated on his hip and he got better. But then he found that the physio that he'd been taught way back, which was really for hip replacement more than anything else, and he tried doing it to himself and he just got sore. So he came up with a whole different method, which largely has led to the sort of things that we do now.
Yeah.
So fairly extraordinary.
Yeah, that's good. I think one of the